So the health insurance marketplace, you might have also heard it called exchanges, but really the terminology we're using now is the health insurance marketplace. This is where people who are uninsured or buy their own insurance are going to purchase insurance going forward. So the thing I always want to put to rest for people, if you're worried, if you already get insurance from your employer, if you get it through CHIP, if you get it through Medicaid, if you get it through Medicare, if you get it through the VA, nothing's changing for you. This is for the 48 million Americans who are uninsured or for those who buy their insurance privately. So everybody else, if you already have insurance, you do not have to worry about the marketplace. This is not going to affect you. I think that's really important to remember. But if you are either someone who purchased your own health insurance or you're currently uninsured, you're going to start purchasing it through the marketplace. And what's important, I'm going to get into the details about it in a minute, but this is going to give you real opportunity for choices based on costs, based on benefits, etc. And I think one of the things that's most important about it is from now on, members of Congress are going to have to purchase their health insurance through the marketplace. They made it good. So there are 3 models available, and I understand this gets complicated. So there are 3 different models available to the states. States got to make decisions on this. So a state could have either decided we're going to run it ourselves. The health insurance marketplace for Virginia will run it ourselves. That would have been a state-based marketplace. Or Virginia could have said, we'll partner with you in the federal government and have done a state-federal partnership model. That's the second model. Or Virginia could have said, which it did, no, we don't want to run it, you run it for us. So we and HHS are actually going to be running the marketplace for you. But it's important for you to know all states. So it's important to know that all states had the option of these 3 options. They could choose how they wanted to run the marketplace. But again, Virginia decided, Governor McDonald decided that we will run the marketplace for you here in Virginia. Now, what's important to know is that there is still time to change to either a state-based marketplace or a federal one. States can apply for funding through us through December of 2014, and so you could still in 2015 have a state-based marketplace. There's still time to make different decisions about it, but for now on, for at least 2014, we at HHS will be running the marketplace for you here in Virginia. You've entered the marketplace. Now you're going to have 4 different metal options, we call it: a bronze, a silver, a gold, or a platinum. And what you might expect is bronze is going to be a very low-cost premium, but high deductibles, high co-pays. You see that 60% next to it. That means that the plan is going to cover 60% of the cost. You're going to cover the other 40% of the cost. Now, if you're 27 and healthy, you probably want a bronze plan. You want to not making a lot of money. You probably want a low premium, but it's going to have high co-pays, high deductibles because you're healthy and you're counting on you're not going to get sick. If you are 55 with diabetes and hypertension, you'll want a platinum plan because that premium is going to be higher. But as you can see by the number I have there, 90% of the cost will be covered by the plan. You're going to be responsible for 10. So you can see that there's very specific options for you that you get to go in and shop and decide where you are in your life, where you are economically, so what works better for you. Higher premiums, low co-pays, deductibles, or a lower premium, higher co-pays and deductibles. So again, it's going to be on what works for you. So I hope that makes sense for you. Now here in the Commonwealth, there's about 520,000 people that we believe are going to get insurance through the marketplace. And again, right now in Virginia, you have almost 900,000 uninsured. And even though Governor McDonald did decide to have us run the marketplace for you, they did apply to us for some funding to establish a marketplace or to think about it. So we have awarded the Commonwealth over $5 million to do some planning in case you do a state-based marketplace. So I said in the beginning that we're actually going to make health insurance more affordable for middle-class families and for small businesses. So how? So I just told you about the different metal plans you can choose from, but some people are probably thinking, well, I probably still can't pay for those premiums. That still might be too expensive for me. So here's the part where it becomes more affordable. We're actually going to provide you with some financial assistance. So if you make up to 400% of the federal poverty level, which is about $44,000 a year for an individual, about $93,000 a year for a family for real middle-class income, the federal government will actually give you financial assistance to pay for the premiums. Now that money won't go to you directly, it will actually go right to the insurance company, so the premium assistance or payments will go right to the insurance companies. But again, if you qualify or if you make up to 400% of the federal poverty level, you actually get financial assistance from the federal government to pay for these premiums. And I'll get into this in a minute, but you will know how much you're getting. That will help you decide which metal plan and which plan you want to purchase. In addition, if you make up to 250% of the federal poverty level, that's about $28,000 a year for an individual and $58,000 for a family of four, you'll get additional financial assistance from the federal government to pay for the co-pays and the deductibles. So there'll be financial assistance if you make up to 400% to pay for the premiums. If you make up to 250%, you'll get extra money to help pay for the co-pays and deductibles. So again, real assistance for people, especially if you make up to 250% of the federal poverty level. You can get the cost to you will be very little, and in some cases, truly virtually free. So again, this is really important to know about the financial assistance available to you to help you purchase your health insurance. So now, one of the statutory requirements under the Affordable Care Act, as I gave my boss, Secretary Sebelius, is the ability to determine what are the essential health benefits. And what do we mean by that? That means any health plan that wants to participate in the marketplace must offer these services. So any plan you purchase in the health insurance marketplace, no matter what the metal level, you will get these services provided for you, these 10 categories of services. This is the absolute floor. Every single plan must offer you these services, no matter which plan you buy, no matter which metal level, no matter what. So that's important to know. Now, if the state was running its own marketplace, it could have added to this list. So, for example, your neighbor state of Maryland, which is running its own marketplace, added acupuncture and chiropractic care. So the state could have decided to add more, but this is the floor. So again, every single plan that you're going to look at in the future is going to provide you with these services. So the enrollment period, which I'm sorry, I know this slide's a little complicated. So enrollment starts October 1st of this year, goes through March 31st of 2014. If you enroll October 1st through December 15th, your health insurance coverage starts January 1st, 2014. If you applied for it after the 15th of that month, so example, if you applied December 16th, your health insurance would start February 1st, and it'll remain that way. So if you applied February 14th, your health insurance starts March 1st. If you apply February 16th, your health insurance starts April 1st. So I hope that becomes clear. But again, the point is enrollment starts October 1st, goes through March 31st of 2014, and then going forward, it will be in line completely with the Medicare open enrollment period, which is October 15th to December 7th. And so how do you enroll? There's 4 different ways you can enroll, either online, in person, by regular mail, or on the phone. And we're actually going to have a 24-hour-a-day, 7-day-a-week call center that gets up and running this June, so just in a couple of months. So even though enrollment doesn't start till October 1st, we have a call center starting this June, so you can get some questions answered ahead of time. But again, somebody's ready to assist you 24 hours a day, 7 days a week. The other thing that's important to remember about if you do it online is we like to say there's no wrong door. So if you go in online, and this is what becomes really important, we've actually created a data hub that shares information with IRS, Social Security, and Justice. So if you go in and you apply online and you put in some information, everything kind of populates itself. So actually, it will already tell you, yes, you qualify for the financial assistance. This is how much you qualify for. You're not going to have to do that math. You're not going to have to figure it out. It's actually going to be populated. That's why we're hooked up with IRS and others. They'll go by what your last year's W-2s were and your filings were. And so it'll tell you automatically. And if, for example, you didn't file at all or you got all your money back, then it knows that you get 100% paid for. So all that's going to be figured out. So that's really important to know that all those data hubs are connected now. So you're not going to have to think about how much financial assistance do I get. That's figured out for you. Now, we understand it's going to be a complicated process for some people, and that's why we're going to have assistance for you, which I'm going to tell you about in a second. But again, when you go in this one door, it's good. The system will tell you, you qualify for Medicaid, you qualify for CHIP, you qualify for the health insurance marketplace. So you're not even going to have to think about this. This is why we say there's no wrong door to go into. It's just going to be one door to help you with all of that. And again, we know this is going to be complicated for some navigator program. As the name implies, we're going to help you navigate the system and help you, decide what health insurance is best for you, what plan is best for you. So in a state like Virginia, where we are running the health insurance marketplace for you, we have funding opportunities. The grant application just got announced a couple of weeks ago. The application process is open right now, and it goes until June 7th. So people can apply until June 7th to get some of this funding to become navigators. You must go through HHS training and get certified. By the way, this is all electronic. You'll do it by webinar. You don't have to leave your desk or your home. You can do it right on a computer. But you do have to go through HHS training and you get certified. And again, you will become navigators to help people as they try to apply for insurance. The important thing to know if you're a navigator, you must be nonpartisan. You cannot steer someone towards a certain plan or a certain company. You must just be able to give them assistance as they try to make their own decisions.